Hello and welcome to People's Dispatch. Today we're joined by Prabir Purkayastha and we're going to be talking about the global situation regarding COVID-19, what is the situation with each of the countries, which are the countries that have somehow managed to control it, and which are the countries that are really not able to do so at all. Thank you, Prabir, for joining us. The numbers as of now, we have crossed 19 million. The number of deaths has crossed 718,000 globally, of course. And we still see the big three countries, the USA, Brazil, and India, recording huge numbers. India especially has crossed 2 million too. So could you right now give us an overview of what is happening, at least as far as the new cases are concerned?
Let's first look at what you said, the global figures. And there we are going to cross probably in a few days the 20 million mark as well, globally. But I think the important part there, and particularly because we are sitting in South Asia at the moment, that right. India's numbers today are steadily rising. What I mean is, if we look at the new infections, then you will see that India is number one on the daily new cases that we are seeing. It's about more than 60,000, 62,000 roughly. And this means that we are rapidly slated to take over as not the most infected country, because that honor will belong to still some time to the United States, but the country with the largest number of new cases. And also when you look at new deaths, of course, the US is number one. It has about 1,200 deaths. Brazil has about 1,226 deaths, roughly the same amount. India has 899 deaths as of last 24 hours. That means we are really at that level also, the third highest number of new deaths. Normally deaths follow the new infections by about 14, 15 days. So if this rate holds good of new infections, we'll probably take over as a leading country in the world in terms of new infections and new deaths, which effectively would mean that we are going to be or already are, one of the new epicenters of the disease. US, of course, will continue to hold that place as well, because it's not that one state of US or all states of US are equally affected. The centers of the epidemic in the US shifts from state to state, and therefore the numbers still keep on rising. We don't see any stop over there. And Brazil, of course, under Bolsonaro, has taken the position that God will help, and Bolsonaro doesn't need to do anything. So that rise continues. Only the precautions people take, and the people do take precautions, as we looked at the Swedish figures also. You will see that the Sweden, all the open activities which though were not under lockdown, didn't see many people. So this is an obvious issue that people will react in a certain way, even if the government does not. And therefore the transmission links do break. If we come to the charts that we regularly do, and if we look at the Newsclick charts, then you will find in the total cases, of course, it's a little difficult to make out what exactly is happening now in the total cases charts. But what you can see is the slope of the chart, and you will find that India's slope still is actually more than any other country in the world at the moment, perhaps with the exception of Mexico. But if you go to the new cases chart again, you will see that India's new cases are rising faster than any other countries. And the interesting part, and the unfortunate part, the slope has been steady. Even the United States, the slopes have changed. They've come down, then again went up, again they've come down. This is true for Brazil as well, that the new death numbers are coming down. India's new case numbers have been rising steadily. That also shows that the police approach to lockdown, which is what India did, doesn't work. And in fact, unless you have cooperation with the people and you have society as a whole work with the government, you cannot control the pandemic. And this is the example that you really need to set before the world. That pandemic is not, public health control is not done through state power and police powers of the state, which is what India did. And that's why you have a failure of the lockdown in India, unlike any other lockdown in any other part of the world. So I think that's an important lesson to learn, that doing lockdown is important, but doing it correctly is important. And if you don't do it properly, then a lockdown actually can make the situation worse, it certainly doesn't make the situation better. And as you can see, Brazil with no lockdown and India with a draconian lockdown, India's case actually starts looking worse. The total numbers of Brazil, of course, are still much higher. But don't forget, we have time yet. If this rate of increase continues, with another 2 months, 3 months, we'll be overtaking at least Brazil, if not the United States. I think United States, this kind of thing will continue. But the other worrying part of it is that there are more epicenters than one today in the world. Initially it was China, then it shifted to European Union, then it shifted to the United States. Now we have 3 distinct epicenters. You have South Africa, which is about 500,000 people. You have India, South Asia in that sense. I don't think it will be kept out of other countries as well in South Asia, but India is certainly leading the charge. And then you have Latin America, and there are a number of countries in Latin America who are affected. You have Brazil, of course, the leader in this, but you have also Colombia, you have Mexico, you have, for instance, Peru.
Peru too.
All these are quite high in numbers, and Peru is particularly more important because the number of the population is not that high compared to the numbers you see. And if you see the total cases per million of population, Brazil and Peru are pretty close. So all of this shows that we are in a situation where there are 3, as I said, 3 very distinct centers of this pandemic emerging at the moment. One is, of course, India and South Asia. The other is the United States, which continues to lead in deaths, in total number of infections. And then you have Latin America, which has a number of countries in it. Of course, Brazil being the worst hit. So that's one part of the issue, that yes, the pandemic has been controlled in large parts of the world with social measures, with the containment measures, with lockdowns, but with the support of the people and various public health measures. Simple lockdowns haven't worked. No lockdowns like in Brazil, of course, don't work. And model lockdowns of the United States hasn't led them to any safe place either. So you have positive lessons and negative lessons to learn. And the most negative lessons to learn is to have a muddled approach, or an approach which decides to use the police powers of the state against a microbe. And that doesn't work in this case either.
Absolutely. And Prabir, in this case, another key debate also has been regarding vaccines. So there's been a lot of interest in the kind of research that's going on. Many of them have entered trials. Also a lot of debate going on right now about what will be the cost of these vaccines, how easy is access going to be, especially for poorer people in the world. So could you throw some light on what's currently happening on that ground also?
You know, with the kind of successes we have seen in the phase 1, phase 2 trials, I think we can be cautiously optimistic that a set of vaccines will be available by end of the year. Now, whether it will be 1, 2, 3, 4, we don't know. But a set of vaccines will come through the phase 3 trials. At the moment, there are, I think, 5 vaccines which are already known to be in phase 3 trials. But there are a couple of more. For instance, the Russian 2 vaccines are also entering phase 3 trials. And I think there will be more vaccines in the next 2-3 weeks that will enter the phase 3 trials. So yes, I think a set of vaccines will pass and show they're effective against the COVID-19 infections, SARS-CoV-2 virus, and therefore they will give immunity. How much of immunity and what time that immunity will last are open questions. But how much of immunity is, suppose it gives us 70% immunity, right, which means 70% of the cases I won't fall ill, that's a possibility. Or that 70% that my infection will be, even if I'm infected by infection, will be not as severe as somebody who didn't have the vaccine. Both would be good. Other part is how long will the vaccine protection last? Those are open questions. We don't have answers to that as yet. But yes, vaccines will be there. The question that will be, the next question that we need to ask is, when will it be available for the people at large? Not for selected people, but large numbers of people. You're talking of something like 500 million to 1 billion doses to be available for a vaccine manufacturer. So at least 2-3 vaccines then can reach half the world's population, which is what we'll probably need to have what is called herd immunity. at least 50% of the population will then have immunity, since another 20% are probably anyway infected, so they have antibodies in their body, so 70% of the people, and we are okay. But for that to happen, we need vaccines produced at scale, and we also need to have the cost low. Now, what we are seeing of, for instance, the Moderna vaccine, it needs 2 doses, but the price they're talking about is something between $32 to $37. Now, that means you're talking of something like $70, $75 for the vaccine alone, and you might have a certain other set of costs associated with it. Now, at that cost, with, say, in India, 1.3 billion people, this is prohibitive. You're talking of $50 to $100 billion of outflow from the country's exchequer, because I don't think we'll impose this cost on the Indian people, at least not 90% or 95% of the people, given our per capita incomes. So this is where the next issue is going to be. When will the vaccine be available? At what scale it will be available? And what will be its cost? Now, of course, there are other vaccines where a lot of investments are being made. The WHO efforts are there with this Gavi and CEPI organizations, which are bankrolling a set of vaccines. But again, the issue there is, from what we understand from the WHO, that's not going to be available before middle of next year. So you are looking at least from the beginning of next year, vaccines being available, but not for the people. WHO vaccine may be available from middle of the year. But even when you come to the WHO vaccine, which is where we had earlier discussed the issue, that what is the price it will be available, be clear that the patent pooling argument, which is what has been given in the World Health Assembly's resolution, actually talks this vaccine being made available at concessional rates to countries which are among the poor countries in the world. I think there is a set of 87 countries or 90 countries who are declared by the World Bank and others as poor countries. So they will be available at concessional rates to that. But what about Latin America? None of the Latin American countries, maybe barring 1 or 2, would qualify for that. What about India, which is a poor country by any standards, if you take per capita incomes or whichever standard you want to take? But according to the US, India doesn't qualify to be a developing country. That made, when they made that declaration, it made the ruling party, BJP, some of their leaders happy that now we have become a developed country in the views of the United States. What it means is all the trade concessions then are then denied to you. And particularly, even in this case of COVID-19, the vaccine would then not be made available to you at concessional rates. Again, we come to the market rate of the vaccine. We know the influenza market rate is roughly $20 in 5. Now, if that is extended here, we are talking, if it is 2 vaccine injections that would be required, we are talking of $40 if you take the flu virus as the baseline. So I think those are huge questions that we have to answer. How will it be made available to the people? But don't forget, unless you have mass vaccination, you're not going to get rid of the pandemic. And if you don't get rid of the pandemic, as all results show, the economy does not open either. Sweden has proved it, the US has proved it, that opening the economy doesn't make for economic growth. If people see infections, people see the pandemic is still raging, and then all that you do is to infect people more, but you don't really recover from the economic downturn you have had. As I said, Sweden is a classic example. The US has a drop of the GDP calculated now of something approximately 33% year on year, if you take this quarter's into account. And at the same time, you have China, which shows an upturn of their economy, because they have been able to contain the epidemic, and because of that, their economy has really opened, because people are willing to come out, go out and eat, which is actually economic activity, go out and buy, economic activity again. But I don't think you're going to see people flock to the stores or to eating places or to entertainment places without a normalcy in terms of the pandemic itself. And that's the reason why the cost of the vaccine, if it is treated just like any other market goods, is not going to help the world in terms of addressing the pandemic concerns.
Thank you so much, Prabir, for talking to us. That's all we have time for today. Keep watching People's Dispatch.